My name is Michael Kinzer. I'm a medical epidemiologist with the CDC, and I've been sent to Madagascar to assist the government of Madagascar in its response against the current mpox epidemic. The U.S. CDC works with governments all over the world on public health problems, both to help those governments solve problems that are affecting their people, but also to learn lessons that can be applied around the world and protect the global population. We're supporting the government both financially, but also with technical support, working with the Ministry of Health's Emergency Operations Center on a daily basis. Our financial support takes the form of combined trainings through partners of district staff who are directly dealing with cases of mpox in reporting cases, finding cases, following contacts, vaccinating contacts and other people at risk of being infected, and then managing the data that's collected in the course of fighting the disease. We're working with the Ministry of Health to help manage the information that they're collecting while fighting mpox so that they can better understand the situation and take steps to reduce transmission and protect the population of Madagascar. The systems that we're helping them put in place will make our success against mpox more likely this time, but also prepare the Ministry of Health for fighting epidemics of the future. The lessons we learn while fighting mpox in Madagascar not only will protect the people of Madagascar, but will help us protect the people of other countries that may soon be fighting this terrible disease. Partners supported by the U.S. government in the fight against mpox are working in areas of finding cases, following contacts, educating populations at risk for being infected, and vaccinating both populations at risk for being infected, but also populations that are at risk for severe disease, like those living with HIV. We're working side by side on a daily basis with the national response at the National Institute for Public Health, helping them to make sense of the data that's coming in and to target their interventions to try and break transmission. Mpox is a disease that is spread by person-to-person contact in households and with partners. It is not an easy disease to fight, but it is possible to have success against it, as shown in the region of Buen, where cases are starting to decrease after prompt and focused action. The most important intervention in fighting mpox is called contact tracing. Once we find someone who has the disease, we collect the names of their family members and people they might have interacted with so that we can follow them over time. We can vaccinate them to prevent them from getting sick, but we can also identify when they get sick very quickly and isolate them to prevent them from infecting anybody else. And that's the way that you break the transmission of mpox in a community. Madagascar can succeed against mpox if it continues focusing on areas of maximum transmission and also giving clear communications to the population so they can understand how to protect themselves.